Welcome to another episode of Follow the Brand. I am your host, Grant McGaw, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal story, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. Hello, and welcome to another exciting episode on the Follow the Brand podcast. I am your host, Grant McGaugh, CEO of 5-Star BDM, where we help you to build a 5-star brand that people will follow. Joining you from the heart of the podcasting world where millions tune in to discover the movers and shakers of today's industries. Today, we are honored to have a special guest whose name is synonymous with excellence in the healthcare sector. I introduce to you Kim Toliver, a true titan in the field of healthcare management and leadership. Kim Toliver is not just any professional. She's a mastermind with dual BS degrees in healthcare administration and organizational management. An array of prestigious certifications like CMPE, CPC, and CMOM. Her journey of over 2 decades in healthcare is marked by groundbreaking achievements and an unwavering dedication to advancing the field. As the co-author of Revenue Cycle Management, Don't Get Lost in the Financial Maze, Kim has emerged as a leading authority in navigating the intricate financial landscape of medical practices. Her exceptional leadership skills have steered medical practices to the coveted MGMA, better performing practice distinction in accounts receivable and collection. But Kim's influence does not stop there. She is a celebrated thought leader, having chaired crucial committees like the Practice Management Committee and the Government Affairs Committee on the Board of Directors of MGMA. Her collective efforts with MedCHI, the Maryland State Medical Society, have been pivotal in enhancing healthcare legislation and member practice improvements. Her role as an adjunct professor at Catonsville Community College underscores her commitment to nurturing the next generation of healthcare professionals. And it doesn't end in the classroom. Kim's extensive community involvement includes leadership roles like the president of the PG County MD chapter of AAPC and co-founding the Prince George's County Practice Managers Association. Kim's dedication and service have earned her numerous accolades, including the MGMA's 2016 Outstanding Service Award, the State of Maryland Governor's Volunteer Service Certificate, and the Heart to Hand Incorporated 2019 Heart of Gold Award. Today, Kim Toliver stands as a beacon of inspiration, a mentor, and an advocate for the healthcare industry. Her expertise spans revenue cycle management, practice management, software mapping, and content development. Let's dive into the world of healthcare mastery with the remarkable Kim Toliver on the Follow Brand podcast where we are building a 5-star brand that you can follow. Welcome, everybody, to the Follow Brand Podcast. You know, I always want to talk about healthcare, and I want to talk about finance. We have to understand how money flows through a healthcare system, why that's so important, what are all the facets around it. And one of the things that my next guest is so well versed in, first, she understands personal branding. She has her own brand. She's doing a lot of things in her own podcasting. She understands this is a way to get the word out, to have the narrative, to speak her truth. And she's going to speak her truth today with me on the Follow Brand Podcast, and I can't wait to hear from her. So, Kim, you like to introduce yourself?
Absolutely. Well, first of all, Grant, thank you so much for having me on. It's such a pleasure to talk to you. And I'm Kim Toliver, and I am the president and CEO of Medical Revenue Cycle Specialists. So as you talk about, all of the facets related to healthcare, that's what me and my team and I kind of focus on. But we're focusing on the financial aspects of healthcare so that care delivery can reach the people that it needs to. I have, without dating myself, I have over 20 years experience in healthcare leadership. In terms of some of the expertise that I've gained over the years, my education, my degrees are in healthcare administration and organizational management. I have certifications from accredited healthcare organizations related to certified professional coding, which gives me insight into interpreting physicians' documentation and medical records and auditing that information. I am a recent fellow of the American Academy of Medical Practice Executives. That was a mouthful. So that fellowship was just bestowed earlier this year. And in that fellowship, it gives me a keen insight into oversight of healthcare operations for small to large healthcare entities. But it also allows me to stay on top of what is trending, what will happen, forecasting healthcare innovations, reimbursement, compliance, and all the things that make healthcare continue to work. And then my last certification is a certified medical office manager. So having that really basic insight into operational excellence within a medical practice. Some of the other, I would say, achievements that I've had in my career is I have authored 2 books. One is on revenue cycle management, which is all of the information that you need to understand in order to get paid for healthcare services. But it also points out the importance of understanding what we call the quadrants within that revenue cycle. And you and I will definitely talk more about that. And the second book, which was recently published, is on healthcare financial management. And you would think, well, what's the difference between revenue cycle management and financial management? And it's kind of, when you think about getting paid for your services, going through that whole process of interacting with your patients to get that payment, interacting with insurance companies to get those reimbursements. And on the financial management side, you have to manage those finances. You have to have cost accounting. You have to understand all of the complex guidelines to make sure that your healthcare organization is financially sound. So that's what the second book is about. Both books were published by Medical Group Management Association. And I think, some of the other highlights of my career that have really been very impactful for me is volunteering my time on leadership boards. So giving back to the community that has given me so much, whether it's a hospital board or a medical society, healthcare, national healthcare organization, local organizations. I'm here in the DMV, the DC, Maryland, Virginia area. So working with Howard University and the University of the District of Columbia. That's a little bit about me. I would love to tell you like how I got into healthcare, if that if that.
No, we're gonna get there. We've got to understand your journey. This is important. But before I even ask that, because this is the question that comes up in my mind. You are very well versed. You're very educated. You have a lot of great experience in your field. What is usually the biggest challenge when you're engaging with a client or you see the organization? What is the gap that you're filling for them? Because they're like you just said, difference between revenue cycle and difference between finance management. There's got to be some areas that's like, I want to be able to educate people more in this area because it's so important.
So one of the gaps that I feel is when you think about physicians, so when we work with medical practices, physician-owned or led medical organizations, they don't teach this in medical school. They don't teach revenue cycle management. And believe it or not, in many healthcare-driven degree courses or studies, this isn't taught. So that's one of the gaps that my team and I are trying to fill by authorship and podcasting. I also have a podcast, Rev Dive, but getting the word out about the importance of understanding and leading revenue cycle. So that's one of the gaps that we try to fill is understanding the importance of revenue cycle management, revenue integrity. And I think the other gap that we try to fill is in healthcare, there are not only competing priorities. So when you're involved in patient care, some of the other aspects of running your business aren't as critical to you. And, when it comes to making sure someone's life is being taken care of. So we fill that gap. We prioritize the management of the business of medicine.
I like that. That's helped giving me some clarity to think through. And I know my audience is giving us some clarity to think through. I like how you said that this is not taught. So you're getting on-the-job training in running your medical practice business. And a lot of people don't understand it. Even in hospital settings, it's really made up of a lot of smaller businesses within the healthcare system. So that's why you have all these different facets. And like I said, there's competition that's going on. And you have to look at all these facets to understand how this benefits the whole. And as you're working with your particular clients, I want to ask you this, because you have a career journey. What got you so interested in this particular field? I mean, how did you get into this?
My grandmother. My maternal grandmother, both of my grandmothers immigrated to the U.S. From Trinidad and Tobago. And my maternal grandmother, she came here as a maid for the hospital president, a hospital president. And she was really interested in healthcare based on the work that she was doing with him. So she started a career in hospital, ended up becoming an entrepreneur, owning her own call center. So that's kind of where the entrepreneurial bug kind of bit me. Growing up in hospitals with my parents and, other family members who have worked in healthcare has really kind of motivated me to kind of keep that legacy going. So that's kind of what prompted me to get into healthcare. Both my parents and brothers, sisters, aunts, uncles, so many of us are in healthcare in some form or fashion.
So your legacy healthcare, you say your DNA.
Yes.
And you're a businesswoman. It's like that's part of your DNA. I mean, your grandmother, kudos to her, coming all the way from another country, working as a maid, and then becoming an entrepreneur. That's a wonderful, great story. I want you, because this is important. Entrepreneurship. You own your own business. This is your own business and what you're doing. Talk to us like the challenges of owning the business And because I've got other clients, I know other people that are in revenue cycle management, and they're like, man, we're trying to get traction. We're trying to get going, opening and getting clients and doing our business because it's a lot of work. What advice would you give to them?
Gosh, there's so much advice that I would give. You also asked the question, what's some of the challenges of entrepreneurship?
Yeah.
There's no one to tell you what to do, right? You are creating the playbook for your organization and for your clients and for your team, right? So that's a great responsibility. The advice that I give entrepreneurs is become an expert in the field that you are going to be in. And that takes a lot of research, a lot of trial and error, a lot of risk. And for me, I'm not afraid to take risks. As an entrepreneur, for those of us in the world who are entrepreneurs, we understand risk is a part of the game. It's what it is, right? So don't be afraid to take risks. Don't be afraid to fail. Also, don't be afraid to put yourself out there and do things that you're uncomfortable with. So for me, early on in my career, I had terrible stage fright. I did not like public speaking at all. And now I'm on national stages with, hundreds of audience members who are high profile individuals, and we're just having conversations. So do it afraid. That's what I would suggest. Do it afraid.
Wow. Great advice from someone who's living it, who's doing it. And you say your business is in the DC area, but are you more locally focused or are you nationally focused?
Both. So locally, the great thing about being in the DMV is Maryland and DC, Virginia as well, but especially Maryland and DC, we have very unique reimbursement and healthcare compliance rules that allow us to be innovative and thought leaders for the country. So one example is Maryland has what's called a total cost of care model. This model allows Maryland to get a higher rate of reimbursement by Medicare for hospital services. But there's a risk to that reward, is that we have to reduce hospital readmissions, hospital acquired infections by a certain percentage over a certain period of time. So that means that we have to be really innovative and methodical about how we deliver care in this state. So those requirements have fostered innovation. It has fostered a very high-tech health information exchange, which is called CRISP, that is both in DC and Maryland, that allows all of our health systems to be interconnected, which is unique in the country. It also allows us to have community physicians and hospitals working jointly to collaboratively reduce patients' readmissions. So working together, letting a physician know when their patient is being discharged from the hospital so that you can grab them, take care of them so that they don't get readmitted.
I want to ask you this about how money flows through a healthcare system. Everybody knows that's a challenge. It goes in one door and comes out a completely different door that you didn't expect it to go there. You've got to track all that stuff. As you see the industry trying to transition to more value-based care, you might see it more in your clinical settings than hospitals. Maybe you've got private institutions, you've got nonprofit, you've got publicly owned. How is that policy change, or how does that affect your business, and how do you engage with clients when they like, hey, I'm about to go to this value-based care. I had a fee-for-service model. I sort of kind of understood that, but now this is radically going to change things. What advice do you give?
So the way that it's impacted my business is it keeps us very busy.
Yeah.
All of these changes keep us busy because not only do you have to interpret and understand those changes, you have to enact those changes. So it's one thing to make sure you completely understand those changes, but implementing them in a sustainable way within your organization is the biggest obstacle, because you have technology considerations, you have financial considerations, you have patient experience considerations, you have workforce experience considerations. So there you have your space and your certification. So there are a lot of factors. So when we have one change in healthcare, those 4 to 5 factors that I just described all have to be taken into consideration prior to implementation of any workflow augmentation in a healthcare facility. So it takes a lot of rolling up your sleeves, understanding and interpreting those guidelines, also having a voice. So one of the other things that we do is advocacy. So I sit on a few boards locally and nationally, and I do some advocacy on the state level in the Maryland General Assembly, in making sure that legislators understand the impact that the legislation that they are putting in place, how that's going to impact what I consider small businesses. Medical practices, in some instances, are small businesses. And when legislators hear how these changes impact healthcare organizations, it really gives them a better understanding of whether or not this legislation is actually going to be beneficial or harmful for their constituents.
This episode is brought to you by 5-Star BDM. 5-Star BDM is a professional consulting and advisory group keenly focused on business development services for small to mid-sized businesses and entrepreneurs. Although every business is unique, they often share challenges that can be addressed through smart branding. Services include process improvement in operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our 5-Star Business and Personal Branding Company has helped a number of professionals and organizations to optimize and grow. The result is more business, more opportunities, better reach, positive outcomes. Please visit www.5starbdm.com to learn more and view all the episodes of Follow the Brand. That is so important. And it definitely will affect your business, especially going to value-based care. They've been talking about it for a number of years, but mandating it, just like they did, with the EHR systems through meaningful use, so they had to get that going, but it was a big disruption. We're now getting used to it now. It took some time, but we all are using it, good or bad, and we're starting to now innovate because of it and see if we can get to a better playing field when it comes to patient experience and that type of thing. Talk to me a little bit more about how do you see technology, the way it's been implemented now, because you work with these giant financials, so you see what they do. Maybe they can do track. I know like some of the EHR systems are big into billing and coding, and that's how you're able to report. You're going to get it, look at the CMS codes, things of that nature, so it matches up, because everybody wants to get paid for their services. And you've got to stay up to speed and all this different stuff. So how do you view technology in your business?
So technology is one of the main drivers of success and sustainability in healthcare organizations. So from my business perspective, technology is the priority of any engagement that we're in. We work with quite a few technology firms as their clients to help them understand the impact that their features have on their clients. Because we kind of walk with their clients, we're hand-holding their clients, and there's definitely those opportunities for disconnect when you have folks programming technology out of the box and having someone implement it within their practice, but it may not meet their specific and unique workflows. So when I think about technology, what what I like to focus on and what I suggest healthcare organizations focus on is mapping their unique workflows to their technology. There's so many times that I've seen throughout my career where medical organizations feel that the technology has failed them and it has let them down and it's not doing what they need it to do. When in fact, when I look at some of the technology that's out there, there are so many use cases for technology in medical practices. We haven't even scratched the surface. So it's really about understanding what technology can do within a healthcare organization, how it can improve workflows and patient experience so that you're optimizing the technology for your unique needs. And I'll give you an example of that. Medical record documentation. So an electronic health record. When a physician is documenting their visit with their patient, they're using their EMR, right? Their EHR. One of the ways that we can innovate the use of that technology is creating condition-specific note templates. So let's say a patient has depression or another patient has history of stroke. Having condition-based medical records specific to that condition helps the physician do a couple things. It helps them with time, right? So they have a template that they can follow that allows them to capture everything necessary for that specific condition. You talk about value-based payments. Within all certified EHRs, there is a value-based payment dashboard that is extracting information from that visit note that the provider has documented. So the better the documentation, the better the quality scores are for that provider who is participating in a value-based payment model. So those are just a couple examples of how we can innovate and optimize the use of technology within healthcare.
That that right there. Someone is listening to this right now, like, I need to hire her. I need to hire her like right now, because finance is a big stumbling block in a lot of healthcare systems. They like, wow, and it's just because sometimes it takes a while to get paid for services. It could take months sometimes to get these things done, and then you're in this wrestling match, right, with the payer system. Right? You got the provider, the payer, patient. They're all wrestling, with these different monies that are taking place. So they need somebody that, like you, to say, you know what, before you even enter the field, before you even go to the stadium, you need to understand this. And if you have this in place prior to, the match you're about to enter into, I guarantee you're going to enter into some kind of match, when it comes, everybody wants to hold on to resources and having that understanding of finance, business, the technology, and how that flows together for maximum impact. Give us some idea. Do you have like a favorite story of how you helped a particular client that was struggling and they were able to employ your services and it came out on top?
Sure. So there's a lot of examples there, but I want to focus on what you just talked about in denial prevention. Payer reimbursement guidelines are not standardized. So Blue Cross Blue Shield has reimbursement guidelines, United Healthcare has reimbursement guidelines, Aetna has reimbursement guidelines, Medicare, Medicaid, and then the state plans have their own reimbursement guidelines. So, the first thing that we want folks to do is understand those reimbursement guidelines to develop denial prevention programs. So that's one of the things that we like to do is to implement denial prevention programs so that you avoid denials by having clean claims going to those insurance companies, right? One of the ways that we help healthcare organizations is by doing a revenue cycle assessment. So the revenue cycle assessment, if you kind of think about all of the components related to getting paid for your services, what we do, excuse me, is we assess current operations, and we create. We go in, sometimes in person, sometimes virtually, and review all aspects of the organization's revenue cycle. We document our observations, and then we create a work plan with our recommendations. And those recommendations are prioritized in a manner of recommendations that are going to impact patient care, compliance, or payment. And as we create those recommendations, we're also creating outstanding work plans for healthcare organizations that allow them to either have us manage the deliverables of the tasks within those work plans, or we deliver this work plan to the healthcare organization so that they can just start working on each item. So example, one item would be that a specific insurance company, I try not to use insurance companies' specific names to de-identify this conversation. A specific insurance company changed their authorization process for a certain cardiac service. And this practice is a cardiology practice, and they're providing this service on a regular basis without knowledge that it requires authorization now. So after we've done that research, we then implemented a process for obtaining authorization for this service prior to the physician going and providing this service. One of the things to think about with denial management is there are certain denials that cannot be reversed. So if you get a service denied because you did not receive authorization, you cannot bill the patient for that. So that means you've just delivered this service for free. So what we do is create those denial prevention programs that are evidence-based off of the revenue cycle assessment that we conduct and deliver.
That right there is always going to be a benefit to somebody, because there's nothing like doing a service for free that you didn't, you're expecting that revenue to come in, like, oh, no, you got tripped. I call it getting tripped up at the goal line, right? You thought you were going in the store, like, no, fumble. Like, what? So that's a major thing. So I do want to hear about success story, because we've got down here, I'm in Florida, there's a lot of physician groups here. And they, like to your point, they understand medicine, they understand how to deliver medicine, but they're not very good entrepreneurs all the time. They didn't go to school, they didn't get an MBA, let's say, they get a PhD, they didn't get an MBA. So they struggle from the business aspects of it. Give us, if you got a success story that you think would be impactful for that type of audience that you would like to share, I would really appreciate it.
Sure. So for private practices, there's a couple success stories that come to mind. When we're working with private practices, there's sometimes that we'll do those medical record documentation audits, right? And what we're doing there is we're reviewing the documentation that the provider entered into the EMR based on the visit that they had with their patient. There are so many complex guidelines related just to documentation. Forget about compliance and payments and all. Just documenting the information, there are rules that come along with that. So one of the success stories that I would share is we were working with a healthcare organization, and their EMR was not programmed to include the assessment and plan in the progress note. That is a huge red flag, because at the end of a visit, you need to have an assessment and a plan. And that's one of the components to selecting the level of visit that a provider is going to bill. So that could invalidate your entire claim. And this was happening for hundreds of services. So when we did our audit, we identified that, worked with their programming team so that the assessment and plan is now populating in the progress note, worked with them on, some special projects related to the insurance company to make sure that they understood the rules related to claim submission, and saved them a lot of money. We put in a process that allowed them to remain compliant. We did some fraud and abuse education with them, and documented that, because anytime you identify a mistake, which is, could be considered waste or abuse, you have to take action on it. So what we did is we created an airtight process for them, so that this situation wouldn't reoccur.
That is, these are the stories we need to hear. This has been very, very educational for me personally. Just understand what you've established yourself as a thought leader on a number of different stages and are respected in this space. And I love how you said how you're unique, and that because you're in that Baltimore, Washington, DC area, that you get privy to a lot of these different regulations that are taking place, and you can innovate. So when you start looking at even other regions of the country and seeing what they're doing, because I'm in the Florida region, there's a lot going on down here as well, that you can really, truly be impactful. Before I let you go, I want the audience to understand how to contact you as far as your business. Let them know why this is so important and how they can engage with you, especially going into 2024, where revenue is always top of mind.
So, absolutely. So folks can connect with me. I would first start by saying connect with me on LinkedIn. We are very active. Again, my name is Kim Toliver, Kim with an E. Feel free to connect with me on LinkedIn. My team and I, we blog a lot about healthcare finance and compliance and all things related to reimbursement. So check me out on LinkedIn and other social media platforms. My website is what is my website? I should know that. medrevenuecycle.com. We also have really great information related to the healthcare services that we provide, blogs, and additional trending information that we share. We work with health departments to provide them with updates and resources related to billing, coding, and revenue cycle management. So we also offer that to our audience as well, in another perspective. And then you can also check me out on everywhere that podcasts are available. Rev Dive, that's REV for Rev, and Dive, DIVE, diving into revenue cycles. Spotify and Apple Play and all the other places. That's where you can find me. But you can also find me on the road. Like, I do a lot of travel. Okay, I'm speaking everywhere: Nashville, San Diego, Florida, you name it. So if you happen to see me at a conference, please stop me, say hi. I love to meet you. And in terms of 2024, CMS, the Centers for Medicare and Medicaid Services, released the final rule, which also includes the Medicare physician fee schedule, regulatory updates, compliance updates, coding updates. All of that is now available at cms.gov. I am going to be speaking about that next year, January, February, and March in different locations. But it's so important to understand what CMS is doing every year, because all of the commercial payers and state Medicaids usually follow CMS's way of thinking. Doesn't mean that all insurances are going to do exactly what CMS does, but CMS is the benchmark for regulatory compliance, coding, and reimbursement in healthcare.
I understand it. I'm glad you brought that up. I was going to ask you, are you part of the HFMA?
So yes, I think I've spoken at an HFMA conference. I certainly keep up with what they're doing. I use their benchmarks, their KPIs and benchmarks in some financial modeling for healthcare organizations. So yes, I absolutely endorse HFMA. And speaking of healthcare organizations that I'm affiliated with, I'm also affiliated with Practice Management Institute, PMI. I'm a faculty member there and create content and deliver content for them. Also with Medical Group Management Association, MGMA. I do a lot of content development, delivery, authorship, and other collaborations with them. AAPC, the American Academy of Professional Coders. I was a former chapter president for AAPC. So, those are just a handful of some of the organizations that I would highly recommend that folks join or learn about. HIMSS, the Health Information Management Society.
System Society.
Thank you. I was like, is it System Society? HIMSS is another organization that, when you think about rounding out where to go to get excellent, credible, reliable healthcare information, HIMSS, AAPC, MGMA, HFMA, AHIMA, PMI, those are some of the organizations that I strongly recommend.
I love that. I'm the program chair for HIMSS South Florida.
Okay.
And we just recently got an award for Go Chapter of the Year. So very, very happy about that. Yeah, a little high five on that for sure. I know the HFMA people here, the MGMA as well. We had to bring you down to be a speaker at one of our particular events that are going to be taking place to get you down here in sunny Florida. How about that?
Listen, sign me up.
We're going to definitely get on your schedule. This has been wonderful. I want to encourage your entire audience. They can tune into all the episodes of Follow Brand. And that is at 5. That's number 5 star BDM. That's B for brand, E for development, infomasters.com. I am so happy that you shared your brand with us today, Kim. This has been wonderful.
Thank you so much for having me. And I appreciate your audience and everything that you guys are doing in healthcare or whatever fields that you're in.
You're welcome. Have a great 2024.
Yes.